Hi, I'm Dr. Mukesh Gupta, gynecologist from Lenest, Malad, Mumbai. Semen analysis instructions. What are the things that a partner should be aware about when he gives the semen sample for analysis? We're going to divide this whole instructions and tips into three major zones: before collection, during collection, and after collection. Okay, so top 5 tips before the collection. What are those? First and foremost, that when you're planning to give the sample, remember you need to have abstinence, meaning refraining from having sex or masturbation or ejaculation in any form for at least 2 to 5 days. If for some reason it's not possible, at least 24 hours should be a good time, and maximum 7 to 10 days. If you make it late, then there are more dead and debris bumps. If it is very frequent, then the volume may be lesser, and then we may feel that the report is not good and unnecessary harassment and stress. Second tip is that when you're planning to do the collection, beforehand go and check the location of the lab, and preferably pick up the containers, the sterile container from the lab at that time, so that after your collection you don't waste your time in reaching the lab. And that's a very precise and important thing that you need to be aware about. Next thing that you need to understand is that you have to reach the lab within an hour, right? So you need to time your collection as per that time of the day. So it can be preferably a good time to do it in the early morning hours so that you reach the lab on time. Fourth tip is, remember that you need to avoid taking any medications or drugs or alcohol or similar such thing, because that actually may cause a little bit of a problem. And for example, if you are on some drugs which can affect your sperm count, sometimes these medications like Ayurvedic bhasmas and other things which are heavy metals may also affect to some extent. But there are some other medicines which, like multivitamins and other things, which may not be a problem. Please check with your doctor. Avoid having alcohol, tobacco, or any form of recreational drugs, because that can affect your count miserably. In fact, make it a point to not to use it ever, because you don't want to land up with losing your sperm count because of these bad habits. Last but not the least is that when you're planning to do the collection, see to it that you have the mind state that you're relaxed. It is not necessary for you to get worked up before the collection, because we understand that this is the first time that you're going to do it, and also it is a very anxious state of mind. But just stay relaxed. It's not a big deal at all. Now, during the collection, what are the top tips that you should follow when you are planning to do the collection? Firstly, when you're doing the collection, get hold of the container. Keep the lid of the container open. Remember, when you're going to masturbate and release the sperms, you don't want the spillage to happen while you are opening the container. So keep the container open. Clean the tip of your penis or phallus clean it up properly and dry it later on. If you have got the foreskin to be withdrawn, just see to it that everything is clean before you do that, because we don't want any contamination happening at that time. Next important thing is that ensure that it spills within the container and it doesn't fall outside. If it falls outside, you're not supposed to pick it and put it inside again. Keep your stuff ready. If for some reason you find it difficult to get your erection or find it difficult to give the sample, be ready with your stuff which can help you and stimulate you, or it can help you to have arousal. Sometimes you may not be able to collect yourself and you need your partner's help. It's okay. Tell the doctor that you need your partner's help, and then you can do the collection at home or in one of the rooms, private rooms, so that it is possible for you to do that. Remember, don't use lubricants or condoms which are available outside which contain spermicidal jelly, because if you collect in condoms and then you give the sample, it may cause toxic effect on the sperm and the count may not come as good. That's another golden tip. If you have any such problems, talk to your doctor. Probably he may be able to help you with toxic condoms which can be used in some rare cases. Last but not least, if you land up with any contamination in the form of your pubic hair or a thread or cotton or something like that, do not disturb it. Let it be. Seal the container and let the lab people clear it with clean instruments, and don't try to contaminate the sperms. After the collection, now what are the tips that you need to be following once you have finished the collection? Most important thing, seal it and label it. Your name, age, time of collection, date of collection should be very clear on the container so that there is no goof up. Pack it into a small bag, preferably a paper bag or something, or a napkin or similar size, or towel or handkerchief. Remember, the temperature that the sperm has to be is as close as the body temperature. It doesn't make sense to keep it in your pocket, because a lot of jerks while moving can cause problem. It can be held in the hand. Don't keep it in the glove compartment or in your wife's purse, because it will be having a lot of movement and will cause problem. We want minimum physical insult to the container, and also minimum changes in the temperature for the sperm, so that it gives a genuine report. You have to reach the lab within an hour if you've collected it outside. So the best thing is to do the collection in the lab itself. Most of the labs in the country do not have a separate semen collection room, and you may have to land up doing it in a extremely not comfortable toilet. So be prepared for it and don't be worried about it. Lastly, for some reason, if you're not able to ejaculate or masturbate at that time, don't be scared, don't be worried. Lots of people go through this anxiety and trouble. That doesn't mean that there is any problem. You can always try again afterwards. There's no rule that if you're not able to produce sample once, you will not get pregnant. No, it is just a state of mind. And never get mentally bogged down or worried if you're not able to produce the sample at the first time for the semen collection. You can always try again later on. Thank you very much.